wash my hands. My name is Sarah Hankey. I'm a PA student here at UTMB, and I'm just going to do your neurology exam today. Okay? Do you have any questions before we get started?
No.
Okay. And what is your name?
Veronica.
And where are we today, Veronica?
I'm at the UTMB clinic today.
Okay, great. And what is today?
Monday.
Okay. And so I just assessed the patient for orientation to person, place, and time, her mental status. I would also look at the patient to assess her level of consciousness, her state of awareness. I would assess her apparent state of health, look for any signs of distress. I would also look at her posture, grooming, hygiene, and I would look at her manner, mood, speech, affect, and everything appears to be normal. Okay, so now, Veronica, I'm going to just look at the exposed areas of your skin and your scalp, okay? And I'm looking for lesions, any abnormalities of texture, temperature, discolorations. I'm going to test the skin for turgor and mobility. And if I were to see any lesions, I would put on gloves. But there don't appear to be any. Okay. All right. So Veronica, now I'm going to move on to assess your cranial nerves 2 through 12. We're going to start off with cranial nerve number 2, visual acuity. So do you wear any contacts or glasses?
No.
No? Okay. We're going to start off by doing an eye test. If you can hold this out for me. Okay, and you can drop the string. And just read the lowest line possible.
LTFPH.
And can you cover one eye and do the same?
LTFPH.
And cover the other eye.
LTFPH.
Okay, and that's cranial nerve 2. I will also check for cranial nerve the fields of vision. So just tell me when you can see my fingers, okay?
I can see them. I can see them. I can see them.
Okay, excellent. So now I'm going to move on to cranial nerves 3, 4, and 6, and this is extraocular movement. So first I'll just assess the patient's eyes for alignment and positioning. And now if you can follow the tip of my finger, keeping your head still, okay? Okay, and now I'm going to test convergence and divergence, also an extraocular movement.
Last time she just chose to.
Okay, excellent. So now I'm going to test cranial nerve 5. So if you can just clench your teeth down for me. Okay, and that's feeling for the masseter. So now I'm going to do cranial nerve number 7. So if you can just make these facial movements with me, okay? So wrinkle your forehead, smile, and grimace. Okay, great. So now I'm going to test cranial nerve number 8. So this is auditory acuity. So just tell me when you can hear something and on which side.
Left.
And tell me when it stops.
You know what I mean? Like,
Stops.
I always remember the first
And
and last.
Right?
You know, memorization.
And tell me when it stops.
Stops.
Excellent. Okay, so now I'm going to move on to cranial nerves 9 and 10. I'm going to get my light source and a tongue depressor to inspect your uvula and soft palate. So if you can just open your mouth and say ah for me. And no deviation of the uvula or the soft palate.
Student or, like the St. Vincent.
So now I'm going to assess cranial nerve 11. If you can just shrug your shoulders against my hands.
Yeah, I think so. I
And
didn't know.
cranial nerve 12, can you stick out your tongue for me? Excellent. Okay. So now I'm going to look at your deep tendon reflexes bilaterally. Okay. So I'm going to start off with your brachial radialis, your brachial reflex, and this is C5 and C6, and I'm going to do that bilaterally. Okay, and now I'm going to do the bicep reflex. Okay. And both of these are C5 and C6 as well. Now I'm going to test the tricep reflex, so just rest your arm in my hands.
Oh yeah, she told me.
Nice and relaxed, okay?
This is my chicken. Oh, this is my.
Okay. And this is C6, 7, and 8.
Crock pot recipe.
Arm. down to your patellar reflexes. And this tests L2, 3, and 4.
Alright, good luck. I'll see you tomorrow.
Good luck, y'all.
And again, 2, 3, and 4 in the patellar reflex. Now I'm going to assess S1 and S2. And this is the Achilles reflex. And I'm also going to do the Babinski side, or the plantar reflex. And this is S1 and S2 and L 4 and 5. Okay, excellent. And also I need to inspect the nail beds on the hands and the feet, just to make sure that there's no abnormalities there. Okay, excellent. So now I'm going to do the ankle clonus. Okay, great. And now I'm going to test for vibrations on 3 of the DIPs of your hands and your feet, okay? So can you just close your eyes for me? And then tell me when you can't feel vibration anymore.
Can you feel it? I can't feel it. I can feel it. I can't feel it. I can feel it. I can't feel it. I can feel it. Stop. Yes. 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 Stop.
Okay, great. So now I'm going to do a test called sterognosis. So if you can just close your eyes and open up your palms and tell me what's in your hands.
Coin.
Okay, and again.
A key.
Excellent. Okay, so now we're going to do a test called the soft touch test. So this is what it feels like, okay? So I'm going to just touch this on a couple places on your legs, arms, chest, and face, and if you can just point to me where I'm touching, okay?
Point to?
Yes, please.
Okay. Down. Down.
Now I normally do this with shorts on.
Yes, I can feel it. 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 Yes. 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 Yes.
Okay, so now we're going to do a test to see how well you can differentiate between a sharp and a dull object. The sharp object is going to feel like this,
Mm-hmm.
and the dull object will feel like this.
Okay.
Okay? And again, I'm just going to touch a couple places on your legs, arms, and chest. Okay?
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull.
And I would normally do a couple spots on the top of her leg as well. Okay. So now, one more test. If you can stand up for me, we're going to test the cerebellar function. So if you can just walk from here to the table over there, normally for me. Yes. Excellent. And if you can walk to me on your toes. And walk back on your heels. And then walk heel to toe. Excellent. Okay, so now if you can just stand right here for me, we're going to do a test called the Romberg's test. So I'm just going to have you close your eyes. Actually, let's come over a little closer to the bed. You can just stand right here. Okay, So the bed's here and I'm here. If you lose your balance, but if you can just close your eyes for me and then just try to keep your balance. And I'm looking for instability or an inability to stand up straight. Now do this for 20 to 30 seconds. Then you can go ahead and open your eyes, okay? All right, so now I'm going to do a test called the pronator drift. If you can hold your arms out in front of me and again close your eyes and just keep them level. Okay, and then I would watch for 20 to 30 seconds to see if she could hold them level or if one arm drifted, indicating abnormal cerebellar function. Okay, you can go ahead and open your eyes. And if you want to take a seat for me. Do you have any questions before we finish up? Okay, well that should be everything. Nice to meet you.
Nice to meet you too.
Have a great day.